Hello, I'm Ian Askew and I'm pleased to talk about our paper Righting the Wrongs, Addressing Human Rights and Gender Equality Through Research, co-authored with my colleagues in the Department of Reproductive Health and Research at WHO and other experts, and published recently in the Sexual and Reproductive Health Matters Journal. The ICPD conference in 1984 and various declarations since then have emphasized the need to reduce gender inequalities and protect human rights if countries are to achieve their sustainable development goals. However, strong evidence is needed to inform the policies and programs that both deliver on safe and effective sexual and reproductive health services, as well as enhancing gender equality and human rights. Our 25-year review paper argues of a need for a different approach to research. There's been much gained in terms of research approaches and evidence over the last 25 years, but we feel that more is needed to better understand the complexities of the social determinants and social changes needed to inform the political will that will be absolutely essential to achieve these Sustainable Development Goals. Notable progress has been made in terms of research investments made by donors and in the programming used to support the types of research needed. We've also seen that there have been explicit research governance management mechanisms established to really enhance the way in which gender equality and human rights are addressed in research programming. For example, for my own research program, we have a Gender and Rights Advisory Panel, which was established 21 years ago now, and which reviews all of our research studies in terms of the way in which they address gender equality and human rights. We found through the research that's been undertaken over the last 25 years that the centrality of unequal power, whether it's between individuals, between communities, between groups of populations, these really are at the heart of what influences women's and girls' access to health services and their experience of good health status. We've also learned that the contextual factors of society, economics, development and culture all contribute to unequal power relationships and end up influencing the degree to which women's and girls' health is of the highest possible standards. Research on outcomes must also address the access to and equity issues around health services, as well as issues around safety and well-being. And we need to make sure that that research also addresses whether or not the interventions being provided reduce inequalities and protect and promote human rights. What has come out also over the last 25 years of research is that gender and rights are important in themselves, but also they interact with many other social determinants and many other factors that together can end with multiple discriminations against individuals and populations. And it's these discriminations which the research needs to inform and provide evidence about what works to reduce discrimination and improve the equalities between gender and in terms of human rights. We've also seen mixed progress in terms of the research done on different aspects of sexual and reproductive health. For example, there has been a lot of research undertaken around contraception, around HIV, and around maternal health, but much less research around issues such as infertility, other sexually transmitted infections, and abortion. We'd like to conclude in our paper by recommending that integrating gender equality and human rights issues in the process by which research is conducted is absolutely critical to be able to unpack the evidence that's needed from experiences, from the needs and preferences of users of SRH services to make sure that policies and programs really are set up to deliver and to make sure that everyone is able to achieve the highest standards of sexual and reproductive health. Thank you.